Evening.
Good evening.
Name and address for the record, please.
My name is
Thank
Dr.
you.
Patricia Ricci. My address is 161 Albert Avenue. I am not a resident near the range. However, I am a Cranston resident, and when I learned of what these unfortunate people were having to endure, it compelled me to come to speak to all of you. I received my MD from Brown University, Warren Alpert School of Medicine, and did a 4-year psychiatric residency at Brown University. I am board certified in both psychiatry and neurology. I come here to speak to you about the damage that having a barrage of gunshots throughout the day, day after day, can do to people. Average people, adult people, and children. You've heard the frustration that these people have in their voices. It's quite evident. And they've been going through this for years. I ask all of you, is your home your solace? When you go at the end of the day, after a long day of work, do you seek out a place of refuge? Imagine what it's like to hear gunshots throughout the day. Physiologically, it does a lot of damage, and you heard that in Dr. Melissa Mangili's letter. Physiologically, it affects the blood pressure. It adversely affects the cardiovascular system. It also raises cortisol levels in the body when you have stress constantly by hearing that barrage, and the nervous system is deluged with it. Cortisol levels, when they're elevated in the body, affect your immunity. So that means that it affects all illness, cancers, infections. So I was just talking about the average person, correct? Imagine someone who has a history of violence, either physical violence, sexual violence. If somebody is a vet and has been to war. I actually worked for 2 years at the Veterans Hospital in the PTSD clinic. So I know what it's like. I know what it's like when someone can't sleep at night, when they have to have their back against the wall because they're terrified. Imagine what gunshot sounds do to these people. People with generalized anxiety disorder, many of them in our society, many of them in the neighborhood. People who have panic disorder, agoraphobia. So I plead with you, this is not something that can wait because the impact is huge and it's happening now and it has been happening for years. You have the power to do something about it. And I implore you to do something. And I also want to say, I understand that the police have to practice. I'm certainly aware of the fact that they're here to protect society, but this is not a protection of society. This is actually harming members of society. So I implore all of you to act. Thank you for listening.
Thank you. 4 minutes exactly. That was well done. Good job. Good evening.